In today's other news, we have powerful words from the World Health Organization amid rising cases of monkeypox. WHO Chief Tedros Adhanom Ghebreyesus said a committee of experts who met on Thursday was unable to reach a consensus, so it fell on him to decide whether to trigger the highest alert possible. This is what he had to say. Take a look.
So in short, we have an outbreak that has spread around the world rapidly through new modes of transmission about which we understand too little and which meets the criteria in the international health regulations. For all of these reasons, I have decided that the global monkeypox outbreak represents a public health emergency of international concern. The outbreak has continued to grow, and there are now more than 16,000 reported cases from 75 countries and territories and 5 deaths. WHO's assessment is that the risk of monkeypox is moderate globally and in all regions, except in the European region, where we assess the risk is high. Although I'm declaring a public health emergency of international concern, for the moment, this is an outbreak that's concentrated among men who have sex with men, especially those with multiple sexual partners. That means that this is an outbreak that can be stopped with the right strategies in the right groups.
So I think this is a call to action. This is not the first. The DG brought the committee together. It was an alert to the world. The WHO has been highly active on this since day one. This is not the beginning of the response. This is an intensification of his calls to the world that we must act now and we must act together, as we have been acting up to now. But like every effort in human human science and human health, there are times when you must accelerate that effort, and I think today's call is for an acceleration of our collective efforts to bring.
A viral infection resembling smallpox and first detected in humans in 1970, monkeypox is less dangerous and contagious than smallpox, which was eradicated in 1980. The first symptoms of monkeypox are fever, headaches, muscle pain, and back pain during the course of 5 days. Rashes subsequently appear on the face, palms of hands, and soles of the feet, followed by lesions, spots, and finally, scabs. 95% of cases have been transmitted through sexual activity, according to a study of 528 people in 16 countries published in the New England Journal of Medicine, the largest research to date. The Cambodian Health Ministry said a Nigerian man who went on the run after becoming Thailand's first monkeypox case was found in Phnom Penh on Saturday and taken to hospital. This comes the same day the World Health Organization officials in Geneva declared the monkeypox outbreak as a global health emergency on Saturday. A Thai health official said a 27-year-old tourist who had overstayed his visa in Thailand was diagnosed with monkeypox in the resort city of Phuket on Monday. During his stay in Phuket, the man had visited 2 entertainment venues and 142 people are now being screened for the virus, according to a health official, adding that the man also had unprotected sex with a woman. After learning of his diagnosis, he fled his Phuket accommodation, turned off his phone, and failed to respond to police or health workers' messages. His getaway sparked a manhunt across Thailand, and authorities said his phone signal was detected in a northeastern province bordering Cambodia. After searching several locations Saturday, Cambodian police found the runaway at a Phnom Penh guest house, and he has since been sent to the Khmer Soviet Friendship Hospital for medical treatment. In order to prevent the infection of monkeypox virus, the Ministry of Health appeals to all people who have direct contact with a Nigerian patient to isolate themselves and seek health checks, according to the Cambodian ministry in a statement. Monkeypox is not as contagious as the coronavirus, according to the WHO, but since a surge of infections were reported in early May outside West and Central African countries, where the disease has been endemic, it has affected more than 16,800 people in 74 countries, according to a tally published this week by the U.S. Centers for Disease Control and Prevention.
The European Union's drug watchdog on Friday recommended for approval the use of Imvanex, a smallpox vaccine, to treat monkeypox. Imvanex, developed by Danish drug maker Bavarian Nordic, has been approved in the EU since 2013 for the prevention of smallpox. It was also considered a potential vaccine for monkeypox because of the similarity between the monkeypox virus and the smallpox virus. Let's listen in.
The vaccine itself is actually the smallpox vaccine. The MVA-BN technology, which is our smallpox vaccine that has been approved for a long time, also got this indication back in 2019 for monkeypox. We have a annual capacity in our manufacturing site at approximately 30 million doses annually. So we can produce quite a lot of doses. We can, with the current demand, we can easily supply the global market. So it's a vaccine which is in stockpiles many places, in many countries, and it's a vaccine that can be used both if you are exposed. So if you are vaccinated a few days after you are exposed, you can also be protected. But you can also, of course, use the vaccine as a prophylactic vaccine, meaning before you are exposed to the disease, before you are exposed to monkeypox.
Imvanex, developed by Danish drug maker Bavarian Nordic, has been approved in the EU since 2013 for the prevention of smallpox. It was also considered a potential vaccine for monkeypox because of the similarity between the monkeypox virus and the smallpox virus. Monkeypox is less dangerous and contagious than smallpox, which was eradicated in 1980. The first symptoms of monkeypox are fever, headaches, muscle pain, and back pain during the course of 5 days. Rashes subsequently appear on the face, the palms of hands, and soles of feet, followed by lesions, spots, and finally scabs.